Hello, my name is Chloe Johnson, and this is my mini lesson on asthma. Asthma is defined as a chronic lung disease characterized by episodic bouts of wheezing, coughing, and difficulty breathing as a result of the narrowing of the pathways in the lungs. This increases the resistance to the airflow in and out of the lungs and makes it harder to breathe. Asthma is actually the most common lung disease of children. As you can see, one or more of the issues may affect the student's lungs and ultimately make it harder to breathe. The bronchial passages may be narrowed due to tightened muscles, an increase in mucus production, or inflammation. As a result, the chest may feel tight, the student may wheeze or cough, and this is all related to respiratory distress. Within the Maine Unified Special Education Regulation, also known as MUSER, asthma is categorized as an other health impairment. This is defined as a student having limited strength, vitality, or alertness, including heightened alertness to environmental stimuli. That results in limited alertness with respect to the educational environment. Asthma is directly affected by environmental stimuli. These include environmental allergens, food allergens, excessive activity, and emotional stress. When the student is subject to an asthma attack, they are consequently unable to be attentive to the educational environment. In severe cases, the student may be removed from the environment or even taken to the hospital in an emergency. Asthma is the leading cause in absenteeism. Students with asthma risk falling behind in academics due to absenteeism. Students are also at risk of social isolation. Due to health risks and medical restrictions, students may be restricted from activities or otherwise unable to fully participate with peers. Students are also at risk of a reduced quality of life due to environmental and health factors that restrict them from activities or environments that their peers are involved in. Since asthma is affected by physical exercise and environmental allergens, athletics is one of the most overlooked aspects of school regarding children with asthma. It is important to keep the child engaged in some form of exercise, even if it were to be greatly modified and made more accessible to them. A good option for athletics would be swimming, because it occurs in a warm, moist environment. Accessing knowledge of proper use of medications and the accurate following of an action plan should be taught to the affected students. You can take some time together with the student to create an action plan using the health plan that should be located in the nurse's office. This action plan can be posted in the classroom and, more importantly, kept on the student at all times. Having made an action plan, the student is less likely to have an asthma attack, and it can be used during an attack, which is especially helpful if you or the student feels panicky during the attack. Instructing students and other personnel of keeping the classroom and other environments clean and free of trigger allergens is important in reducing the risk of asthma attacks. Due to a high risk of absenteeism, be sure to develop a plan with parents on dealing with missed assignments. Create this in advance so that the child won't fall behind on their academics while hospitalized or homebound, and they can just keep going. To ensure proper social adjustment, the student should be involved, connected to peers, and seen as a normal student. The use of a peer buddy to assist with carrying materials throughout the school day, if needed, could be arranged. This peer buddy serves as an assistant in times of need, as well as a social partner to engage with. In the case that physical restrictions are recommended by a doctor, active participation should still be given to the student so that they may continue to be a part of the group. This can be a modified activity or a kind of involvement with being the scorekeeper or equipment manager so that they're still involved and in part of their class. If students are not able to attend outside recess, the student should ask other students to play games with them in the library or classroom. It's not advisable to use recess time to catch up on missed assignments, for this just further ostracizes them from their peers and makes them feel different and also makes their peers see them as different. Action plans, such as an asthma care plan or special health care plan, should be kept within the nurse's office and include important information to be known, potential triggers, steps to take in an emergency, medical regimens, and when to call 911. Providing access to water or appropriate snacks if needed could assist in reducing the severity of asthma attacks. Providing inhalant therapy assistance, adjusting for administration of medications, or in the least, the monitoring of the student during administration of medications may also be necessary. Bronchial asthma is an important cause of morbidity and mortality. Since the 1950s, studies on the effects of yogic breath, pranayama, asanas, which are physical movements, and meditation has on patients with asthma have been conducted. The conclusion to one of these studies is as follows. Yoga exercise among asthmatic patients resulted in a decreased number of day and night attacks and use of drugs. It also shows significant improvement in the peak expiratory flow rate. And this is taken from an Ethiopian Journal of Health Science from this website. Yoga has been shown to benefit all aspects of the human body, from the respiratory system to the nervous system, to the digestive system, and even the pulmonary system. Using controlled yogic breath, also known as pranayama, can increase blood circulation, lower blood pressure, relax the bronchial pathways in the lungs, and repair damaged nerves. Although medicines and other forms of interventions are definitely necessary in the treatment of asthma, using pranayama and meditation might help people who are afflicted with asthma attacks. So in my activity, I am asking you to combine your breath with your mindfulness, being mindful of your breath. So we're going to do some easy breathing exercises following this YouTube video at the bottom of the page on the right-hand side. Try and be aware of how you feel before and after you do this practice. You can try and check your pulse rate if you'd like to before and after. In the least, sit comfortably, relax, and make sure that you're counting your breaths the same number in as out. so that it's even flow in, even flow out. Controlled breath is what it's called. So I hope that you all enjoy, and thank you for watching my video on asthma.